NLN Nursing Entrance Exam Quiz. Question 1. Which milliliter amount equals 2.4 L in this pH scale item? Option A 24,000 ml. Option B 240 ml. Option C 24 ml. Option D 2,400 ml. The correct answer is option 1 liter equals 1000 ml, so 2.4 times 1000 equals 2400 ml. The other choices use 10, 100, or 10,000 as the conversion factor, which shifts the decimal to the wrong place. Question 2. During a quick NEX review of a solution chemistry item, which word is closest in meaning to essential in a classroom review sentence? Option A visible. Option B unneeded. Option C necessary. Option D fragile. The correct answer is option essential means necessary, so that choice matches the meaning in context. Visible means able to be seen, not necessary. Unneeded means not required, not necessary. And fragile means easily broken, not necessary. Question 3. After checking the choices in a genetics clue item, which answer identifies the process moves water across a semi-permeable membrane? Option A transcription. Option B osmosis. Option C exocytosis. Option D mitosis. The correct answer is option osmosis is the diffusion of water through a selectively permeable membrane. Transcription copies DNA information into RNA, exocytosis moves materials out of a cell, and mitosis is cell division. Question 4. If a cell division stem gives one clear clue, which choice most accurately summarizes the passage? A school added quiet study rooms, and students reported fewer distractions. Option A distractions are always helpful. Option B quiet rooms increase noise. Option C students no longer needed to study. Option D reducing distractions can improve study conditions. The correct answer is option. The result directly connects quiet rooms to fewer distractions. Distractions are always helpful is not supported by the passage, quiet rooms increase noise is not supported by the passage, and students no longer needed to study is not supported by the passage. Question 5. When time is limited on a bone support question, which critical thinking response best fits this situation? A conclusion says a new study method caused higher scores, but the groups were not randomly assigned. Option A higher scores prove every student studied more. Option B the conclusion should ignore group differences. Option C random assignment is never useful. Option D the conclusion may be too strong because another factor could explain the scores. The correct answer is option. Without random assignment, group differences may affect the result. Higher scores prove every student studied more does not follow from the situation. The conclusion should ignore group differences does not follow from the situation, and random assignment is never useful does not follow from the situation. Question 6. Given the information in a muscle movement item, which sum equals 5/12 plus 1/3? Option A 5/3. Option B 1/12. Option C 3/8. Option D 3/4. The correct answer is option. The denominators are already the same, so add the numerators, 5 plus 4 equals 9, then simplify to 3/4. The other choices subtract the numerators, multiply parts of the fractions, or change the denominator unnecessarily. Question 7. Suppose a similar nerve signal item appears on test day. Which word is closest in meaning to gradual in a classroom review sentence? Option A loyal. Option B sudden. Option C metallic. Option D is slow. The correct answer is option. Gradual means slow, so that choice matches the meaning in context. Loyal means faithful, not slow. Sudden means quick, not slow. And metallic relates to metal, not speed. Question 8. While working through a timed endocrine message set, which answer identifies the tiny air sacs exchange oxygen and carbon dioxide? Option A bronchi. Option B villi. Option C nephrons. Option D alveoli. The correct answer is option. Alveoli provide thin, moist surfaces where gases diffuse between air and blood. Bronchi carry air toward the lungs, villi absorb nutrients in the intestine, and nephrons filter blood in kidneys. Question 9. Before choosing an answer in a glucose regulation item, which choice most accurately summarizes the passage? A report says infection rates fell after staff completed a hand hygiene refresher. Option A, hand hygiene cannot affect infection. Option B, the refresher removed all risk permanently. Option C, a training may have improved compliance with hygiene practices. Option D, a training increased infection rates. The correct answer is option. The sequence suggests training supported better hygiene behavior. Hand hygiene cannot affect infection is not supported by the passage. The refresher removed all risk permanently is not supported by the passage, and training increased infection rates is not supported by the passage. Question 10. A student sees this chart reading idea on a NEX review, which increase is shown from Monday 17 to Wednesday 27 in a simple practice chart? Option A, 44. Option B, 10. Option C, 27. Option D, 7. The correct answer is option. The increase is the final value minus the starting value, 2717 equals 10. The other choices use the final value alone, only the Monday to Tuesday change, or the sum instead of the difference. Question 11. 1 ratio setup practice problem tests the skill, which dose volume gives 187.5 mg from a supply of 75 mg per 10 ml? Option A, 25 ml. Option B, 50 ml. Option C, 2.5 ml. Option D, 12.5 ml. The correct answer is option. Set up the proportion 75 mg, 10 ml equals 187.5 mg x ml, so x equals 187.5 times 10, divided by 75 equals 25 ml. The other volumes reflect errors such as doubling the dose, having the dose, or reversing the proportion. Question 12. Several choices look tempting in a unit conversion item. Which word is closest in meaning to modify in a classroom review sentence? Option A, change. Option B, ignore. Option C, freeze. Option D, repeat. The correct answer is option. Modify means change, so that choice matches the meaning in context. Ignore means not notice, not change. Freeze means make solid by cold, not change generally, and repeat means do again, not change. Question 13. For this percentage item nursing entrance question, which answer identifies the chemical messenger released by endocrine glands? Option A, antibody. Option B, hormone. Option C, platelet. Option D, enzyme. The correct answer is option. Hormones travel through the bloodstream and affect target tissues. Antibody targets antigens, platelet helps clotting, and enzyme speeds chemical reactions. Question 14. In a short fraction item practice STEM, which choice most accurately summarizes the passage? A clinic sends appointment reminders, and missed visits decline. Option A, reminders can help patients remember appointments. Option B, reminders caused more missed visits. Option C, patients cannot benefit from reminders. Option D, appointments no longer need scheduling. The correct answer is option. The decline in missed visits supports the role of reminders. Reminders cause more missed visits is not supported by the passage. Patients cannot benefit from reminders is not supported by the passage, and appointments no longer need scheduling is not supported by the passage. Question 15. Among the choices in a mean score item, which answer identifies the transfer of heat through direct contact? Option A, a convection. Option B, evaporation. Option C, radiation. Option D, conduction. The correct answer is option. Conduction transfers heat when particles collide through direct contact. Convection moves heat through fluid circulation, evaporation is liquid changing to gas, and radiation transfers energy by waves. Question 16. Using the facts in a probability set question, which average results from scores of 75, 79, and 83? Option A, 79. Option B, 8. Option C, 237. Option D, 77. The correct answer is option. Add the 3 scores to get 237, then divide by 3 to get 79. The other choices use the sum, the range, only 2 scores, or an added value rather than the mean. Question 17. Based on the clue in a test strategy item, which word is closest in meaning to precise in a classroom review sentence? Option A, gentle. Option B, ancient. Option C, vague. Option D, exact. The correct answer is option. Precise means exact, so that choice matches the meaning in context. Gentle means mild, not exact. Ancient means old, not exact. And vague means unclear, not exact. Question 18. Consider this high-yield main idea concept. Which answer identifies the cell division that produces gametes? Option A, diffusion. Option B, mitosis. Option C, meiosis. Option D, translation. The correct answer is option. Meiosis reduces chromosome number and produces sperm or egg cells. Diffusion moves particles down a gradient. Mitosis produces identical body cells, and translation builds proteins. Question 19. Near the end of a inference clue review session, which choice most accurately summarizes the passage? A study found that students who practiced with timed sets felt more comfortable during the actual exam. Option A, comfort never changes with practice. Option B, timed sets remove all content gaps. Option C, the exam has no time pressure. Option D, timed practice can build exam familiarity. The correct answer is option. The passage connects timed practice with increased comfort. Comfort never changes with practice is not supported by the passage. Timed sets remove all content gaps is not supported by the passage, and the exam has no time pressure is not supported by the passage. Question 20. Across similar author-purpose nursing entrance questions, which critical thinking response best fits this situation? A test item asks for the best answer, and two choices are true but only one directly answers the stem. Option A. The longest answer is automatically best. Option B. The choice that directly answers the stem should be selected. Option C. The first familiar term should be chosen. Option D. Any true statement is always best. The correct answer is option. Entrance exam items often include true distractors that do not answer the specific question. The longest answer is automatically best, does not follow from the situation. The first familiar term should be chosen, does not follow from the situation, and any true statement is always best, does not follow from the situation. Question 21. Since only one choice fits the summary task clue, which 4 flow rate delivers 0.25 L over 2 hours using a 10 GTT/ml set? Option A, 125 GTT/min. Option B, 2 GTT/min. Option C, 1250 GTT/min. Option D, 21 GTT/min. The correct answer is option. Convert 0.25 L to 250 ml, then use 250 times 10 divided by 2 times 60 to get about 21 GTT/min. The other choices come from common errors such as skipping the drop factor, using hours instead of minutes, or rounding before the final step. Question 22. From the information in a sentence correction item, which word is closest in meaning to rapid in a classroom review sentence? Option A, fast. Option B, dull. Option C, fragile. Option D, slow. The correct answer is option. Rapid means fast, so that choice matches the meaning in context. Dull means not sharp or interesting, not fast. Fragile means easily broken, not fast. And slow means not fast. Question 23. At a testing desk during a punctuation review, which answer identifies the solution with pH above 7? Option A, acidic. Option B, basic. Option C, neutral. Option D, hypotonic. The correct answer is option. A pH above 7 indicates a basic or alkaline solution. Acidic describes pH below 7, neutral describes pH 7, and hypotonic describes lower solute concentration. Question 24. Inside a pronoun agreement science or skills item, which statement gives the best main idea of this passage? A patient education sheet used short sentences, headings, and pictures. Option A, clear formatting helps readers understand health information. Option B, long paragraphs are best for patient teaching. Option C, pictures make written instructions unnecessary. Option D, headings reduce the value of information. The correct answer is option. The sheet is designed to improve readability and comprehension. Long paragraphs are best for patient teaching is not supported by the passage. pictures make written instructions unnecessary, is not supported by the passage, and headings reduce the value of information, is not supported by the passage. Question 25. Through careful reading of a parallel structure stem, which increase is shown from Monday 16 to Wednesday 24 in a simple practice chart? Option A, 40. Option B, 5. Option C, 24. Option D, 8. The correct answer is option. The increase is the final value minus the starting value, 2416 equals 8. The other choices use the final value alone, only the Monday to Tuesday change, or the sum instead of the difference.